I'm going to demonstrate how you do an exam of the cervical spine. Whenever you do an exam in orthopedics, you have to be able to view whatever body part you're looking at. It can't have a hoodie over the back of your neck. You can't be wearing a scarf. You have to be able to see the front of the cervical spine and the back of the cervical spine. So she already has her hair up, which is perfect, and I don't see any surgical scars. And then I come along the front area, and I don't see any surgical scars in the front. You should ask your patient also, have you had any surgeries of the cervical spine? Many times those front cervical scars from an ACDF you can barely see because they put them in Langer's lines and they leave a really tiny scar. So that's the inspection portion. The next is palpation. So I'm going to palpate her cervical spine and ask her if she's having any pain. I will then go ahead and palpate the trapezial muscles on both sides to see if she's having any pain on the trapezial muscles. I also do a very quick down and dirty shoulder exam whenever I'm doing a cervical spine exam, because sometimes people have neck pain and it's not really coming from their neck, it's coming more from their shoulder. So I do just a quick shoulder exam to make sure they have full range of motion, and then I'll ask them if they have any pain with a Kennedy-Hawkins maneuver or a near maneuver. I will check especially their AC joint. AC joint pain of the shoulder can produce pain that radiates down the posterior region of the shoulder into the area of the cervical spine. So I'll spend a lot of time on the AC joint asking, does that reproduce your pain? I'll then do an adduction test, which can also increase pain from AC joint arthritis or an AC joint issue. Just making sure it's not the shoulder, it truly is the cervical spine. The next part I will do is I'll check for reflexes. So C5, C6, C7, she's got great reflexes. I'll then do a quick test to see if she's got a Hoffman's test. Flick the fingernail. The thumb should move spontaneously. That's a sign of an upper tract injury. She does not have that, fortunately. The next thing I will do, since I'm already down at the hand, is I will check her pulses, check her radial pulse. And then since I'm already down in this region, I'm going to ask, do you have any numbness? And I'll go through each dermatome of the upper extremity to make sure that there's no numbness present. Depending on where the numbness is will help me delineate whether this is a disc herniation or a disc protrusion at like C5, C6 or C6, C7. So specifically, if you have numbness involving the thumb and middle finger, use your imagination. This kind of looks like a 6 when I do that, and that would be in the dermatome C5 or C6. I'm then going to go ahead and test for strength. Go ahead and put your thumb down towards the floor. Push up on my hand for me. Great. And then I'll go ahead and have you make a muscle like this. Don't let me break it. So that's for bicep strength. Go ahead and straighten out your arms. Don't let me bend them. That's more for tricep strength. Pull up your wrists. Hold them there. Great. Bring your wrist down. Hold them there. Great. Make the OK sign. Don't let me open them up. Perfect. So that covers the motor portion of the exam. So we've done the inspection, we've done the reflexes, which is the neuro portion of the exam, the strength testing, the sensation, and the vascular. The last portion of the exam that I do is range of motion and checking for a Sperling test. So I will ask the patients to bring their chin to their shoulder, and I will measure it, and then chin to this shoulder, and then chin down to your chest, and then extend your head. And then the last plane of range of motion is just relax your head here. Can you bring your ear to your shoulder here? Good. And then ear to shoulder here. The last test I do is a Sperling test, which is where I rotate their head, tilt their head backwards, and you can relax. That should reduce, or that should cause radicular pain going down the side that I rotated their head to and tilt them back. So I'll do that maneuver and I'll ask the patient, are you experiencing anything? And most of them will tell me that they feel tightness on the contralateral side. That's not a positive Sperling test. The Sperling test is positive if it reproduces radicular symptoms like a zinging sensation or numbness shooting down the arm. And I'll do the Sperling test on each side. And so this is a quick summary of how to do a cervical spine exam.